I've been a program director at the U of T for 6 years now, which is a full accreditation cycle. And I have to say, it's my favorite job I've ever had. Amongst all the things I do right now, it's the favorite thing I have to do. I think in Toronto, we really go out of our way to make it an outstanding educational experience. So it's a 2-year program. The first year, the residents come and they get a really solid grounding in the basics of endocrinology. So that's where they build up their clinical expertise. The endocrinology program at U of T is very excited about 3 particular initiatives that we feel we'd like to share. The first one is the very innovative second-year model we have in terms of the second year of the curriculum, where we let the residents customize the curriculum to suit their needs. The second thing is our advocacy project, which addresses the CanMed's advocacy role. And the third thing is a direct observational tool borrowed from the American Mini CEX that we've adapted to the Canadian CanMed's roles. So right now in our program, in the PGY 4-year, there are 6 residents, and in the PGY 5-year, there are 3 residents. It generally ranges between 3 and 6 for each year. It's actually the largest endocrine program in Canada, though, so in some ways it's a large group, and they get to make friends with each other and form relationships as well. So it works out very well, I think. There's a long history of diabetes discovery and innovation at University of Toronto, dating back to 1920s with Banting and andBest. Unfortunately, with the burgeoning problem in our population with obesity and diabetes, there is a lot of work to be done. There are jobs in this field, and we are working hard to meet this demand. The epidemic of obesity, it continues to grow across the nation. There's so much to be done. A lot of our residents do work when they do their clinics, obviously at least half is done in diabetes, and they also work really hard in their research projects often to try and deal with this particular issue. It's great to meet with all the different residents. It's great to watch them come in all bright-eyed and bushy-tailed, but kind of insecure, and graduate, and 2 years later confident in their endocrinology abilities and go out in the world. And it's nice to become friends and future colleagues with them as well as that process evolves. A couple of times I've taken them kayaking, because the Humber River is near where I live, and that was really a lot of fun too, getting them outside their normal milieu and watching how people have fun together. I think these outings do definitely foster work-life balance for the residents, for myself. It's a way to get to know them, get to know their families, and just been a very positive experience.